involves addressing very complex situations, complex and multiple issues for both the patient and the family caregivers. And secondly, we are also often facilitators for resolution of conflict between any combination of the patient, some family members, the health system, caregivers, etc. In these settings, they are constantly working with patients and families with suffering and distressing symptoms, and often we are confronted with the theme of suffering and death. One of the factors is the patient interaction, but one of the factors is also working conditions. It's also interprofessional relations, the degree of empowerment that a nurse has in a multidisciplinary team, how the team is worked, what the team dynamics are, how team members are communicating with each other. Those kind of roles that you have to play involve a lot of emotional investment from you as a professional. And at some point that can cause what we call burnout, which manifests, which is documented as emotional exhaustion, a level of depersonalization, which means at some point you almost take a step back and you start treating the person as less of a person and more as an object that needs to be managed, and a sense of a loss of purpose, a sort of, why am I doing this anyway? So those are the three kind of things that come up in burnout, and that is the impact of this kind of work on professionals. What causes burnout is when you're dealing with life-limiting conditions, which are first of all very distressing for the patient, are distressing for the family members, and at some point it's distressing for you as the physician or the nurse or the one who's, for example, you're on the journey with them, so you're breaking the bad news, for example, or every step of the way you're giving information which is not going to be happy information. And that is probably why there's more burnout in palliative settings than non-palliative. That's probably the basic difference, is the depth and the duration of your interaction with them. So what we do is, rather informally, if we're feeling a sense of if we're feeling emotionally overwhelmed with a particular case that we are working with, what we can do is talk to our colleagues, talk to our friends, talk to our family, at all times, of course, maintaining confidentiality, which is very important. But it's rather informal, but you at least vent whatever you're thinking about it. There are groups that have, like within organizations that we work in, there are weekly meetings where the whole team sits down and they share what they've done over the last week, and they vent any feelings or fears or concerns that they may be dealing with while working out in the field. So those are kind of informal methods that we have. And then of course at the personal level, a lot of doctors take up hobbies like music and painting and sports and things which help them kind of enjoy a positive side to life. To formalize it though, I think it is important to recognize that it's important to train healthcare professionals, first of all, to be able to identify these symptoms in themselves, because what happens is our training does not include self-care. So we don't learn to recognize when we are feeling a little overwhelmed. As we progress, not only in our own age and personal life, but also experience in our practice, many times we'll be in situations where something is happening and it's resonating with something that's happened in our own lives, or there may be something that gets triggered for an individual. And it's really important for the individuals to understand that, because they need to be able to deal with it. Like for example, if you think of a doctor who maybe 10 years earlier has lost a child to a life-limiting condition, and then later is seeing parents going through the same process of losing their child, we don't know what that would trigger in that doctor, because it's very difficult to have that level of boundary that you're not bringing your own experience into a situation. So first of all, we need to recognize that doctors, nurses, professionals can face these situations. And secondly, I think in our curriculum, the medical curriculum, the nursing curriculum, whatever training programs we have, we need to introduce an aspect of self-care and different coping strategies for professionals. And then these refresher courses need to continue into the service industry. So I think just as hospitals now host CMEs, CME lectures, so continuing medical education for upgrading your medical knowledge, I think similarly there need to be sessions for giving doctors, nurses, and this is across the board, like not just for palliative, because I'm sure even the professionals working in intensive care units, they must be facing a lot of stress. So we need to all be taught coping strategies and how to positively deal with emotions and stressors that come up when you're dealing with distressing situations.